All right, go ahead.
All right, well, my name is Scott Hatcher, and I'm going to be doing a presentation on the Joint Commission. Now, the Joint Commission is considered the gold standard in healthcare. They are an accredited body, or they are, let me rephrase that, an organization who goes and accredits healthcare organizations to be able to receive funding through Medicaid and Medi-Cal, or Medicare and Medicaid. So what the Joint Commission is it's an independent, not-for-profit organization. They accredit and certify nearly 21,000 healthcare organizations and programs in the United States. Their accreditation and certification is recognized nationwide as a symbol of quality. And this reflects an organization's commitment to certain performance standards. Ooh, that slide's out of place. Now, how the Joint Commission came to be is the concept of hospital standardization actually started in the early 1900s by the American College of Surgeons. They came out with some standards that hospitals should follow. And then in 1951 is when the Joint Commission actually came to be. And that was when a group of physicians, different physicians groups decided to join together and to join with the American College of Surgeons and to create a nonprofit organization. Their primary purpose was to provide voluntary accreditation to organizations that met the group's high standards. In 1952, the American College of Surgeons officially transferred its hospital standardization program to the Joint Commission on Accreditation of Hospitals. And in 1953, the Joint Commission on Accreditation of Hospitals officially began offering accreditation. The founding, or the first administrator of the program was Edwin L. Crosby, and he was the first program director. So who is part of the Joint Commission? The Joint Commission, as I mentioned, is made up of a bunch of different groups of physicians groups and healthcare organization groups. Some of them are the American College of Surgeons, physicians, the American Hospital Association, the American Medical Association, and the Canadian Medical Association. Now, the word joint is important, as far as I can tell, because it signifies that all these organizations have come together to create a standard to ensure the high level of patient care. So the term joint is important because it's all these groups who came together and they joined together to come up with these standards. And it wasn't just one group that said this is what you should meet, but it was a joint partnership to create those. The mission of the Joint Commission is to continuously improve healthcare for the public. They do this in other stakeholders by elevating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. Now, their vision is that all people always experience the safest, highest quality, and best value healthcare across all settings. So that's their whole purpose, is to make sure that everybody's getting the highest quality of care possible. Now, what is accreditation? When you get accredited through the Joint Commission, it's only obtained after a thorough review process. The review is performed by specially trained healthcare professionals. They monitor facilities and staff on their ability to provide a safe environment for care, educate patients about risk and options for their diagnosis and treatment, evaluates patients' conditions before, during, and after diagnosis and treatment, protect against infection, and plan for emergencies. So those are all the things that the organizations have to be able to prove that they can do effectively to be able to receive accreditation. The organizations that are eligible for accreditation from the Joint Commission: hospitals, that includes general hospitals, children's, psychiatric, rehabilitation, and critical access hospitals; home care facilities, that also includes medical equipment, pharmacies, and hospice services; nursing care, both in-home and rehabilitation centers; behavioral health and addiction services can also receive accreditation through the Joint Commission, as well as ambulatory care facilities, practices and office-based surgery practices. And then also laboratories can receive accreditation through the Joint Commission. Now, to become accredited, what these organizations have to go through is they have to go through what's called a survey process. Now, the survey process, when it's done by the Joint Commission surveyors, who are professionally trained individuals, visit the accredited healthcare organizations to evaluate compliance to the standards that are created by the joint accreditation group. This occurs every 3 years for everyone except for laboratories. Laboratories are actually every 2 years. And when they go out, when these surveyors go out to do the surveys, they're always unannounced. So if you're an organization, you have a general idea of when they're going to show up, but just because you know you're coming up on your survey period, but it's an unannounced visit. So they just kind of show up. Now, as I kind of mentioned before, the surveyors that go out to do these surveys in the field, they're highly trained experts. They're doctors, nurses, administrators, laboratory medical technologists, and other healthcare professionals. And during the survey, when they're actually at the organization performing it, there's a few things that they do. One is that they select patients randomly, medical records, and they use those medical records to check for compliance to the standards that are set. So they want to make sure that the patients are actually getting the care, treatment, and all those things necessary, and that their medical records indicate that. They also will trace a patient's experience and throughout the healthcare organization. So all the steps that that the patient came through from the time they contacted the facility to the time they left, the education and stuff that they received, and all those things in between their visit. The surveyors will talk to doctors, nurses, and other staff, anybody who interacts with the patients. And then on top of that, they'll observe the doctors and the nurses while they provide patient care, speak to the patients about their experience and how their overall treatment and diagnosis is going. Approximately 77% of the nation's hospitals are accredited. And then within the United States, approximately 88% of the hospitals are accredited through the Joint Commission. The Joint Commission evaluates and accredits a total of 21,000 healthcare organizations and programs just within the United States. That information on this slide specifically was taken directly from the Joint Commission website. And one thing that is to me kind of confusing is that the two where it says approximately 77% of the nation's hospitals are accredited, and then right underneath that it says approximately 88% of the United States hospitals are accredited. I couldn't necessarily figure that one out, except for the fact that the 77% I believe are the nation as in like a whole throughout kind of throughout the world, or at least North America, where the 88% is specifically in the United States. So just some clarification on that, on my understanding of it. I could be wrong. So, why are some of these organizations going to become Joint Commission accredited? There's several reasons why an organization would want to. Just to list them, one is it helps the organization, helps organize and strengthen patient safety efforts within an organization. It strengthens the community's confidence in the quality and safety of care and treatment and services that they're going to receive. It provides a competitive edge in the marketplace. So it's something that you can proudly say about your organization and promote and gloat about. It improves risk management and risk reduction. It may reduce liability insurance costs for your organization. It provides education to improve business operations, provides professional advice and counsel, enhancing staff education, provides a customized intensive review, and enhances staff recruitment and development. And one of the most important things, we'll talk more about this here in a second, but it provides deeming authority for medical certification. And we'll talk about that, what that means here in a second. But some of the other reasons why you should be Joint Commission accredited is it's also recognized by insurers and other third parties that you meet standards necessary to receive their funding. Provides a framework for organizational structure and management, may fulfill regulatory requirements and federal requirements, And it also provides practical tools and strengthen or maintain performance excellence. So there's lots of reasons why someone would want to become accredited, but really the main one to focus on in that list, and from how I feel, is that it provides that deeming authority, or you can receive deeming status if you're if you're accredited from the Joint Commission. So what is deemed status? Deemed status is given to healthcare organizations that want to receive funding from Medicare or Medicaid. Any organization that wants to receive that funding must be certified to meet those federal regulations. The certification is based on a survey that's conducted by state agencies on behalf of the Center for Medicare or Medicaid Services. The Joint Commission, however, has been given deeming authority. So if the Joint Commission, because they have deeming authority, comes out and performs their survey and you meet their standards, you do not have to have that state agency come out and do another evaluation. So because the Joint Commission, once again, has deeming authority, it means that that organization does not need to receive a visit from state agencies to receive deemed status, meaning they can receive Medicare and Medicaid services or money for those services. So the Joint Commission, I already mentioned that, okay. The organization would not then be, on that last little bullet point there, sorry, I'm getting a little out of order, but the organization would not then be subject to Medicare surveys and certification process, but would still be able to receive CMS funding. That's if you get accredited by the Joint Commission, who has deeming authority to give an organization deemed status. Hopefully that's not too confusing. There are some competitors out there to accredit hospitals. There's three main competitors. There's actually a lot of them, but in all the research I did, I found three main competitors. One is the Healthcare Facilities Accreditation Program. They've actually been in existence longer than the Joint Commission, but they're much smaller. And then the other one is I'm not even going to try to pronounce their name. You can see it there, but the initials are DNV organization, and then also the Center for Improvement in Healthcare Quality. Now, those three organizations, all three of those organizations have deeming authority. The DNV one is probably one of the newest ones, and also one of the smallest ones, but in the research I did, they offer some of the most advantages. Now, all three of those main competitors compared to the Joint Commission, they all are comparable in cost, but they differ on the type of survey they're performed and the frequency of the survey. The example is the DNV performs their surveys annually compared to every 3 years. One of the advantages of that is it helps the facility stay current and constant on the standards. One of the online is when the Joint Commission comes out, all these hospitals go into survey mode. Everybody's on their best behavior during those few months within that 3 years when they know the Joint Commission is going to come out, and then they kind of go back to their old practices after the Joint Commission's come and done their survey. The DNV on their website was saying that because they come out annually, it motivates the organizations to stay consistent with the standards to make sure that they're consistently meeting those all the time. So one of the questions I was supposed to answer is, why would anybody choose anyone besides the Joint Commission? And to be honest with you, I really couldn't find a good answer for it. So everything I'm going to tell you at this point is just going to be my opinion. In my research, the Joint Commission is really the largest and most recognizable organization for healthcare accreditation and certification. And it seems like they truly are the gold standard. So to go against that as an organization, I feel like you're kind of putting yourself at risk. You're trying something new, and the community or the other healthcare organizations out there might not look upon you the same way. So to me, it's kind of a risk if you would choose anybody besides the Joint Commission, if for no other reason they're the biggest and they accredit the most people. So when I was thinking about it, why would an organization choose not to be accredited through them? It has to be because of the cost and the complexity of the accreditation process. The cost to be accredited to the Joint Commission is about $33,000 every 3 years. but there's a whole certification process, a whole set of standards that you have to be able to comply with, and those are pretty rigorous standards. Some of the other organizations, their standards are worded a little bit different and aren't as stringent. And the other thing is that when the other organizations come out to do their surveys, they're scheduled visits. They're not unannounced. So this could put less stress on the organization for having to prepare for the surveyors to come out at any time, meaning they can put on their best show on a schedule instead of just having to try to maintain that standard all the time. But from the little bit of research I did, it seems like really the Joint Commission is the gold standard, and I really don't have a great answer for why anybody would want to go elsewhere besides to the Joint Commission. And that is my presentation.
All right. Thanks for that. I'm going to mute you here really quick. I'm getting some feedback. There we go. Great job on the presentation. Thought you did a really good job. I just have a couple questions for you here before we get off here. But what was one of the main things that you learned, or what was one of the things that surprised you the most as you were studying about the Joint Commission?
Really their size, I guess. How many hospitals are accredited through them, and then also the survey process was just really interesting to learn about. I actually have a friend who works in a skilled nursing facility. He's one of the organizers there, and for years I've always heard him stress about it's survey time, and I never understood what it meant, so I actually did this research, and I go, oh, now I get it. It's this period of time where someone can show up at any minute, and they're going to go through and they're going to talk to patients, they're going to talk to staff, they're going to observe everything that happens in the facility, and you're going to be judged on every minute of it. And just having that be unannounced has to be super stressful. But going back and looking at it from a from a patient standpoint, I really like the fact that it's unannounced and that survey process exists, because I feel like the organization has to maintain that standard, because someone can show up at any time and you're being judged on a certain standard. So those were really the two things, is just the size and complexity of the Joint Commission itself and the number of hospitals they actually accredit. And then the survey process was really interesting to learn about.
Right. Yeah. It's working in healthcare, that survey time is definitely a stressful thing. But some things that, we do at Intermountain, and I'm sure they do it at several places throughout the country as well to prepare for these, is we actually have our own internal audits, internal surveys that we're doing to check and see how we're doing to those standards, to make sure that we're not falling outside. So if the Joint Commission were to show up one day and to do a survey, we'd be prepared for that. So great. Well, thank you for that, Scott. I'm going to stop recording right now, but just hold on the line for just a second.
Okay.